Hi, I'm Dr. Hillary Heschauer from Rangeline Chiropractic, and I want to talk to you about energy. So I know you might be thinking, energy, how do I get some of that? Let's talk about it. So, how can we get more energy? What I like to think of it is how to be an energizer bunny. If you grew up in the 80s and 90s, then you know what I'm talking about. But let's talk about energy and how we can get more. It seems like we always want more energy. So, how do we get it? Or what's causing the lack of energy also? So a little bit about me. I'm Dr. Hillary. So I'm the chiropractor and owner of Rangeline Chiropractic in Carmel, Indiana. I've owned the practice for over 14 years and seen many and many patients with low energy and headaches and back pain and neck pain and everything. Besides being an awesome chiropractor, I'm also a business consultant. I own HHJ Consulting, also in Carmel, Indiana. So, what is fatigue or low energy? So, think of it as trouble starting or continuing physical activity, trouble with remembering and concentration, just being blah, right? That's about the best definition that I could think of, is just the starting and continuing things. So if you're thinking to yourself, do I have low energy? Here are some ideas that we came up with that we constantly notice with patients. So afternoon crashes, like think of it like 3 o'clock, you feel the need to do something like eat something, drink something because you don't think you can continue on that day, or you have more than one caffeine a day. So whether that be like coffee and tea in the morning and then sodas during the day and then coffee around 3 p.m., something like that would be a good indicator of low energy. Like if you always need to have the coffee or the caffeine. Also decreased family activities, like let's say you've got young kids and they want to go play and go for a walk, and you're like, it's 5 o'clock, I just got done working, there's no way I can do anything else today. That's another indication of low energy. Or heck, maybe it's in the morning or midday, you still don't want to do those kind of family activities. And if you've got kids, I mean, even pets, we all know how demanding kids and pets can be. Difficult to wake in the morning, where you might be like hitting the snooze so many times or setting multiple alarms to get up because you're just not rested and you have no energy or willpower to get up. And you just don't feel like leaving the house. So, you're not motivated to go to work or go do something or go work out, things like that. You're moody and irritable, and maybe you notice it, but maybe other people notice it for you and they say, why are you in such a bad mood? Or why are you so cranky? Things like that. So if you don't notice it, you could even ask a close friend or family member that you trust, to tell you the truth. Like, are you feeling moody and irritable? Like, does it show on the outside? And then you're not getting your work done. You don't go to work. Maybe you're working from home and you have kind of been slacking on it because you just don't feel like working, or you can't finish like household chores, like the cooking and the cleaning and the laundry. These are like some of the common things that I've heard of with patients with low energy. So the number one cause that we see for low energy is actually headaches. So we're going to talk about the correlation of like the energy and the fatigue with headaches, as like a headache being a cause of that. So actually a few of the most common headaches that we see are sinus headaches. So we're looking at like near our eyes, like on the top and the bottoms. Tension headaches, those often feel like it's kind of like wrapped around or bands like around your head. Cluster headache would be something like it was all on like one side of your head, and migraine headaches. So migraines can be other things like light sensation and vomiting and other things associated with migraines. But headaches in general, we'll just talk about all of them at once. One of the research articles that we have found talks about headaches being the cause of non-pain symptoms like fatigue. So we want to look at a lot of times like the root cause of something as chiropractors and not just mask it. So where maybe if I was tired and had low energy, I would mask it by drinking coffee or an energy drink, right? And the headache, I would mask it by taking a pain reliever. But are we like fixing the root cause of it all? So this is something that like your doctor or chiropractor can look at with you. What's also interesting is that the region of the brain that is affected by headaches is the same region that affects your mood and cognitive functions, such as memory, focus, learning. So if you're having trouble with memory and focusing and learning, and you're getting headaches, you see how these all like correlate together. So we're all looking at this type of pattern. So it correlates with the headaches and fatigue more often than not. I think that sometimes we're easy to jump on the bandwagon of, well, maybe it's a thyroid condition, or maybe it's a low vitamin, but it could definitely be the headaches. And then if we're thinking of, well, how are we going to fix the headaches? I've got you on that one too. So, also another interesting article was about how being associated with headaches is depression. And that's kind of a hot topic lately, the anxiety and depression. So if you have experiences or someone like that, it's okay to talk about that because it's actually very common. I think the more that we talk about things like that, the better it is for everyone. So currently, what do we do to increase our energy? So some things I've mentioned, like coffee, I guess because I'm a coffee drinker and I love the flavor it. So supplementing with caffeine. So they say if it's like more than 1 cup a day, that could indicate a problem. You might have low energy, so you go exercise. So actually you're trying to get some endorphin boost going to give you energy. So maybe you're the type of person that midday needs to exercise to have energy. Or if you have low energy, maybe you choose to sleep or take a nap, or you need those midday naps. That could be something else that you do. Or you could be someone that substitutes food for energy, whether it be good, nutritious food for energy or sugar, like having some candy or sugar rush to get you through the rest of the day. Supplements like B12, I think you probably heard about that, is something that helps with like energy levels. And these are also like energy and vitamin levels are things that can be also checked and addressed with your doctor in doing a blood test and looking at your markers. Medication and self-care. Some people use medication. Self-care, I think of it more as like meditation or something else like that's going to help you increase your energy. Maybe even a little bit of yoga. And then I put illegal drugs because we know that there are some people out there that choose to use drugs to increase energy, whether or not we feel that that's right. That is something that people do. So how can we help? So you've got low energy, you correlate that with migraines, all of these things sound like you or someone you know. Now what, right? Let me go into a little bit of how like chiropractic care can actually help in case you're not familiar with headaches in chiropractic care. It's actually the number 3 thing that I see. So first I see like back pain, and then I see neck pain, and then I see headaches. And I kind of lump headaches and migraines together, but it's out of 3, it's number 3. So chiropractic care, what we do is we adjust a bone in the spine. A lot of times it's in the neck. And by adjusting, it could be gently pushing it back into place, or like more manual adjustment where you feel it pop and move. Some people don't like to hear the pops. That's fine. There's actually 200 chiropractic techniques. So if you don't want to hear your neck pop and snap, you don't have to. There's other ways. So with the adjustment, what that does is it relieves an impingement on a nerve. So if a nerve is pinched, that's like the root cause of the problem. We need to find out where that pinch is and then allow the body to function correctly. So when there's a nerve pinch, then you also get like muscle tension and tightness. So again, you might think, well, I'm just tight, Dr. Hiller. Yes, but why are you tight? So again, looking at like the root cause of it. So with what we call a subluxation, that's where 2 bones are out of place pinching the nerve. Sometimes there's inflammation and tightness next to it, but it causes tension and it lowers the amount of energy coming out. So think of your nervous system like a highway, and you're getting signals from your brain to other parts of your body. Well, if it's pinched in your neck, your brain is communicating only, let's say 50% or something with what it needs to connect to. So not only are you having muscle tightness, maybe some soreness, but it could be causing other problems with like organs. It could be causing headaches, things like that. So when the body is out of alignment, not only do we have pain and tightness and headaches, but also decreases your sleep in your REM cycle. So one of the most common things that patients tell me is they're like, I didn't tell you this before I came, but I was not sleeping well. And ever since I've been adjusting, I sleep so soundly, I actually wake up refreshed. And I go, oh yeah, that's a side effect I meant to tell you about, is that your body will function correctly and allow you to get into your REM cycle, that deep sleep. The problem is if the communication from your brain through your nervous system to other parts of your body is pinched and irritated, you're just not getting that 100% flow from the brain out. So if your body is always constantly trying to work harder because the flow is not correct, you're not 100%, you're going to have issues. I also think of it like a dropped cell phone call. If it's pinched right here, you're getting staticky reception other places, and your body's just not going to work correctly. You're not going to get the sleep. And then you know what else is your immune system is going to decrease. So what do we all need right now during virus and bacteria season? A great immune system. So this is another reason that I see patients, is because they want to be at 100% immune function. That way, if their body had to fight off a virus or a bacteria, that they could do it to way maybe their body was created. But when we've got a brain and body not working at 100% capacity, other things will suffer. So with chiropractic care, it boosts the immune system to help fight off disease and regulates normal body functions, such as sleep, right? Such as digestion. So patients that have digestive issues. I know I'm getting a little bit off topic with the headache and the fatigue, but all of that is related. So if we can get the nerve pinch under control that's causing the headaches and the fatigue, your body will function optimally, like 100%, let's say. So also, if you're stiff because your neck is pinched and you have your nerve pinched and you can't move your neck all the way, you're going to be stiff and you're not going to move as well and do as much things that you wanted to do. Or maybe you won't play with your kids, or you won't go do exercises because you're too stiff and you can't turn your head this way or that way. Those are all things that we can help with. Something that you may have not heard as much about is called dry needling. And it's called dry because there's nothing injected into the skin. It's just a needle. It's like an acupuncture needle. And what we do is we stick it into what's called the trigger point of the muscle. It's deep into the muscle, so it's not just sitting on top. It goes in sometimes up to an inch. And what it does is it hits this trigger point. Think of it like a darts game, but I don't throw them. But I'm trying to hit a bullseye. I'm trying to hit the one spot that's going to relax and the whole muscle will relax. So that's called dry needling. It just works with muscle tightness. It's not acupuncture, but we see such phenomenal results with dry needling. In fact, there's a couple points in the back of the head near the hairline that we do with these little needles. And patients will get off the table and they literally like, my headache's gone. So not only does it help with tightness and like tension type headaches, it all goes hand in hand. So with a lot of our patients, we do the chiropractic adjustments where we relieve that pinching of the nerve, and then we do the dry needling. We also have different massage type of techniques we do at our office for tension, migraine headache sufferers. And so what I've done is I've trained my assistants to do certain techniques to help with that. So we can do that with chiropractic care. And then believe it or not, a lot of patients have poor posture. I know you're shocked to hear that. But in the age of tablets and handheld devices and working from home, our posture is beginning to lack. And that type of poor posture over time can lead to more misalignments in the spine, especially the upper back and neck. So correcting, let's say, the posture or maybe even the ergonomic setup of your computer is going to be key also. So we like to show and demonstrate with you and watch you do specific exercises to strengthen the muscles correctly, and then also loosen some of them are too tight. Right. So any questions? I did have a couple questions that were asked ahead of the recording, so I wanted to make sure that I talked about that. So someone wanted to know, does the dry needling hurt? No, it doesn't hurt. I mean, you feel like a pinprick, but it's not painful. What I think is painful is when you have a safety pin and you prick your finger with a safety pin. Like, I actually think that hurts. And that is nothing like the dry needling. Another person wants to know, do they have to hear the pop? Does it hurt in your neck? So, like I was mentioning with chiropractic care, there's actually 200 ways or techniques to fix what's called that subluxation, where the bone's out of place, pinching and irritating the nerve. We have a little tool that we use here. It's called an activator, and it makes just like a clicking noise, and that gently pushes the bones back into place. Like, I actually love that on my neck. I can relax the whole time without being tensed up. And so I would say about 50% of my patients like a more gentle technique versus a more rough technique, but to each their own. We can do both ways here. So we also have some testimonials on our YouTube channel. So if you on YouTube go to Rangeline Chiropractic, we have some great testimonies from patients. And I know a couple of them off the top of my head that are specific, like headache and migraines. So you can probably search on there and find just like a minute video on there. So we've learned about fatigue, what could cause it. And like I was saying, in our experience here at the office, a lot of the fatigue is caused by headaches. And then we have to look at, well, what's causing the headaches? And that's what we can solve here. We do exams, we do x-rays, we do the full workup. But let's just say you're not quite sure yet. I get it. We do have another free webinar at the end of the month on the 21st. And so if you're not able to attend live, we'll be recording it just like this one. And then we're also going to have a workshop. So we're going to do an in-office workshop about headaches and how we can help. And then we will start on March 10th is when our enrollment period starts for our 6-week headache program. So when you're ready, we are here to help you fix this and like go on with your life, because I've only had a few headaches in my life and I know how awful those can be, migraines included. So best way to reach us is going to rangelinechiropractic.com. There you can find more information about chiropractic care. You can find information about me, our services. And then in the upper corner, there is a book now. So even if you wanted to do a consultation and you wanted to do more like one-on-one questions, I'm happy to do that. I think we block off about a 10-minute free consultation. And then if you're ready to sign up, you can sign up there too. But I hope to see you on our next webinar, and if not, our workshop. And let's fix this fatigue and headaches. Here's a couple of resources. Our website, we're on Facebook also, Rangeline Chiropractic. We have a page. I also have a group that's a private group. It's called Wellness with Dr. Hillary. You can request to join there, and there we put out a lot of more content like this and giveaways and just more wellness type information. On Instagram, we are Rangeline Chiropractic. So if you want to see even some funny outtakes and reels, that would be the place for you. And then a good email address is office@rangelinechiropractic.com. So thank you again so much for attending. And if you're watching this post and this is the recording, thank you for watching. Please feel free to reach out to me in any of those ways. I'm happy to answer any questions via phone, by email, text message, whatever you want. Just want to help. I really do. So have a great rest of your day.